subscribe to our channel, and tap the bell button to receive notification about all new videos. Second week of pregnancy. There's still no baby yet, but around day 14 of your menstrual cycle, which should be this week or early next, ovulation occurs. If you're trying to conceive, knowing exactly when you're ovulating is really important, so be sure to track your ovulation. What is my body doing? It sounds very complex, and in a way it is, but our menstrual cycles really are quite amazing. Thanks to hormone changes, your levels of luteinizing hormone, LH, and follicle-stimulating hormone, FSH, rise and stimulate the production of follicles in your ovary. These follicles are actually fluid-filled sacs containing those all-important eggs, although usually only one becomes larger than the others and produces the egg. That follicle also begins to produce estrogen, which helps the lining of the womb become thicker to aid implantation of the egg. Hopefully, in the 24 hours after the egg is released, one of the nearly 250 million sperm your partner releases will manage to swim all the way from your vagina, through your cervix, and up to the fallopian tube, where it can penetrate the egg. It might sound simple, but this is a 10-hour journey for the sperm. Only about 400 of them will even make it, and only one can burrow through the egg's outer membrane. What happens next? Once his sperm makes it to your egg, the sperm's nucleus merges with the eggs and they'll combine in the following 10 to 30 hours. Believe it or not, this is when the sex of your baby is actually determined, as if the sperm is carrying a Y chromosome, you'll just have conceived a boy, and if it's an X chromosome, it'll be a girl. What can I do to help my body conceive? It might sound obvious, but this is 1 week where you really need to get into the rhythm of regular, baby-making fun. Try to relax and not turn this time into another chore, and have a read of the best sex positions to try when you're trying to conceive. Experts believe the best positions are those that allow you man's sperm to get close to your cervix, and that having an orgasm helps too, as the contractions draw in more sperm. 2 weeks pregnant symptoms. Getting pregnant relies on timing sex for when you're most fertile. This is probably in the 2 days before you ovulate and the day you actually ovulate. If you've got a regular 28-day cycle, chances are you ovulate on day 15. But who the heck has a regular 28-day cycle every month? At 2 weeks pregnant, symptoms of ovulation can clue you in on the best time to have sex and hopefully conceive a baby. You're probably ovulating if you notice these signs at week 2 of pregnancy. Egg white, cervical mucus. Sounds a little gross, but it's true. Your cervical mucus becomes thin, clear, and stringy, like egg whites, as you near ovulation. This consistency helps sperm travel toward the egg. Better sense of smell. Believe it. Hormonal changes boost your ability to pick up different scents, which is probably nature's way of helping you sniff out male pheromones in an effort to procreate. Breast soreness or tenderness. Hormone changes associated with ovulation can make your boobs feel slightly sore. Pelvic ache. As your ovary releases an egg, you might feel a little twinge in one side of your abdomen. This is the phenomenon known as Mittelschmerz, named for the doctor who first documented it. Light spotting. You might notice a small tinge of red or brown on your underwear around the time of ovulation. This happens when the follicle around the egg ruptures. If it's actual bleeding though, it could be something else, such as an ectopic pregnancy, so let your doctor know if you experience something heavier than just spotting in between periods. Increased sex drive. You might just know that you're ovulating and naturally get revved up for some baby-making sex. Cervical changes. If you check your cervix routinely, something women who chart often do, You may notice it becomes higher, softer, and more open when you're ovulating. Some women buy an ovulation test to help them figure out when they might be most fertile. A low-tech strategy is to have sex every other day from about day 12 to day 16 of your menstrual cycle, meaning toward the end of the second week to the beginning of the third.